Good evening, everyone. Can you hear me, guys?
Yes,
Can
sir.
you? Okay, sounds good. Hi. I can't see anything. I can only see my screen right now, so I'm pretty much just gonna be talking to my screen. So, nice to meet you all. I'm Godfrey Tabori, like he said. I'm from Bielsa State, and I attended NDU. I graduated in 2019, I think. Yes, 2019. That's right. And it's good to be here. Thank you guys for having me here today. So I'm going to be pretty much talking about the realities, rewards, and the role of divine direction Japa series. Um, my slide mostly is going to pretty much be focused on like what you need to get to like the UK or the US, but I'm just going to be verbally just talking about realities and rewards and the role of the divine direction. So, what are the realities? So, I think first of all, thinking if you want to practice abroad, it has to be like a decision that has to come from like you because it's kind of like a long journey. You have to write exams. It's like kind of like also financially taxing too. So there's kind of like a lot of things involved wanting to move abroad. So I think first of all you have to make up your mind, and then try to like gather information about what you need to go to wherever country you want to go to. I've just had the experience of um, practicing in the UK and in the US. So that's just what I know about. So that's just what I'm going to talk about. I don't know about much about Australia or any other country. So it's pretty much the UK and the US. And I'm just pretty much going to be talking about my own pathway and then the other things I pretty much know about. So to be honest, like I said, it's pretty much financially taxing. But first of all, you have to make that decision that you want to move abroad and you want to practice abroad. You want to leave Nigeria, you want to practice abroad in like an advanced country and practice medicine well. For me, looking back, I don't really. I didn't really have like I can't really think of any specific reasons that I would say that wanted me to go abroad, but I just knew that I wanted to leave the country. And that kind of like zeal, like we were on strike that year. So I was just thinking, okay, so after graduation, what next for me? So I was pretty much researching like lots of countries and like what it entails to go to those countries. Initially, I wanted to do Germany, but I then knew that I won't be able to go to Germany because of the language barrier. I don't even know how to speak my local dialect back in Nigeria. So I know it's going to be very difficult for me to learn like a new language. So that ruled it out. So the only options I had were like English speaking countries. Um, and then I think after we called off the strike and then graduated during intern year, I'm like, what next? What next? The only country that was pretty much seeming easy for me then was the UK. So I pretty much wrote IELTS, PLAB 1, PLAB 2, and I wrote an MRSC exam. It's kind of like a residency exam. And then I got into residency in the UK. Though in the UK, I did psychiatry. So the reality of that is that it's pretty much very completely different from like the practice in Nigeria. First of all, you have to know that, and I'm sure most of us are medical students. But when you practice in Nigeria, like most of Nigeria practice, I don't know about now. Back then, mostly it's like paperwork. So I'm not sure if it's more like we have like the EMR. EMR is like kind of like a computer system where you like enter your notes, put in orders and stuff like that. So it's completely different. You do everything like on the system there, and then every documentation is very important. Yeah, and there is a lot of things that we let go in Nigeria that patients let slide and stuff like that. But it's not attainable in um, first world countries like the UK or the US. In Nigeria, I think mostly we practice like doctor-centered medicine, like the doctor drives the patient care. But here in the UK and the US, where I've worked, it's mostly a patient-centered care. So pretty much the patient kind of like drives the care. They come to you with their problem. However, if for any reason they don't agree um, with your management plan, they always have the right to get like a second opinion. They also fire their doctors, and then they can also report their doctors, and then you start going through like some disciplinary committee for investigations to see what happens. So it's pretty much completely different, like the way we practice medicine back in Nigeria and back here. and here in the US. I'm currently in the US right now, but I'm just trying. When I say back here, I mean UK and the US. So it's pretty much different. But the good thing is that you're in medical school right now, doing the right things, trying to graduate. That's good. And then hopefully you're going to pretty much do an intern here. Most people do an internship in Nigeria. I think all those are pretty much good because it helps you. Medical knowledge is very essential here. Even if we have like almost all the investigations you can ever think of, you still have them there. So even if you don't pretty much examine your patient well to elicit, like to know the diagnosis, you can just do investigations here to get the results. So mostly here, people just do investigations to get results, but because we have access to it, like we have CT scans 24/7, MRI scans 24/7, which you can easily do. And also, we have bedside echocardiogram, so you don't have to send someone to do an echo and get the report like 7 days later. You kind of like get it immediately. So it's completely different. You kind of like, we have lots of resources here helping to manage the patient in this place. In the UK, it was more of like a free healthcare, so most people kind of like had access to like lots of healthcare. They can just go to the ER and stuff. ER is emergency room, sorry. Basically lots of some abbreviation. So they go to the emergency room, they get free healthcare. But in the US here, um, you pretty much have to have insurance. The only way they will attend to you here in the US without an insurance, it's if you're having an emergency, like you're having like a myocardial infarction, or you're having like a perforated intestine that needs immediate surgery, that you're kind of like dying, then they will attend to you. But if it's something that doesn't need urgent medical attention, then here no one would see you. So it's pretty much completely different. But good thing is that your training in Nigeria kind of helps in the with the medical knowledge part. But then coming here, you have to know how to type very fast. Although we have like kind of, you can dictate your notes and stuff, but we have documentation here is very important because of lots of medical legal issues going on. Like back in the US and the UK, patient it can easily report you and then sue you, and then they start doing lots of stuff. So all these are not to scare you, but I'm just trying to tell you the realities of like the differences here. Like I know back in Nigeria, you can shout at your patient if they don't want to listen to you. I've witnessed this before. I don't know how it is right now. I've been out of Nigeria for a while, so I don't know how it is right now. But here in the US, you really cannot even shout at your patient. It's more of like your patient even shouting at you and doing stuff like that. Although you can caution them to be respectful and stuff like that. You can also fire your patient if you feel that you don't want to see them anymore. But then it's more of like a patient driven medicine here, like practice here. So patient kind of like has all the rights to fire you or continue care with you or get a second opinion. So pretty much I think those are the realities moving abroad. Like I said, like the finances, I'll talk more about the finances in my slide, like what it entailed, like writing the exams for UK and the US, and pretty much some pathways which you can use to kind of get jobs in the UK and the US. Rewards. Now, it's so that's why I said, so first of all, like it has to come from you, like making decisions. Okay, you want to leave Nigeria. Why do you really want to leave Nigeria? Do you want to practice? Is it because of like the money? First of all, like most people, yeah, the money for sure. You're definitely going to be paid better. You can't compare, first of all, the exchange rate, like the dollar or pounds to naira, and I know Nigerian economy is not pretty much doing that great right now. So like the exchange rate is like very like crazy if you're on this side exchanging to like Nigeria. So definitely money wise, you're definitely going to be paid. It's okay in terms of like back in the UK, if you're comparing to the US, it's similar when you're in training, but in the US you pretty much get paid more when you're an attending. Attending just means a consultant. We call our consultants here attending. So I'll be using more of attending. So in the US, after residency, you're pretty paid very well. But during residency, you're not really paid as well as you if you kind of compare the ratio to when you're in residency and out of residency. It's kind of like, I'm gonna say it's like a 1:2, almost 1:10 ratio, like the difference, like how much you're paid after you finish residency and become an attending practicing alone. pounds. So it's kind of like the salary difference is kind of like very big. But in the UK, you're still going to be paid very well. To be honest, in the UK, I think I was very comfortable with my salary in the UK as a trainee, and then as an attending, it's definitely going to increase. But I think the ratio post trainee to post being an attending like a consultant is like just 1:3. So your salary doesn't like jump down much after training in the UK in comparison to training in the US. Now it all depends on where you wanna practice. Some people say, oh, I want to go to the UK because I have lots of friends in the UK and I have family members in the UK or stuff like that. So it depends on like you an individual, like what do you actually want, whichever. And like I said, it's not only the UK and the US that have or only available. There are also Australia. I have some friends in Australia that are practicing right now. Also people in Canada. Canada is slightly difficult, but I know the common ones are the UK, US, and Australia. I don't really know about any other country, so I can't really talk about that. So like the rewards, to be honest, first of all, I talked about like the money incentive. So yeah, that's great. If that's what you're looking for, well, that's up to you. Secondly, I think another big reward is like for me is seeing pretty much. So in the UK, let me go talk about my UK experience. So back in psychiatry, like I know in Nigeria we don't really take, and maybe now it's coming, is improving compared to when I was back in Nigeria, but we don't take mental health kind of like serious in Nigeria. Pretty much if you're someone says, oh, they are depressed, someone pretty much be like, oh, come on, or just kind of say like a random thing to just laugh it out and then that passes by. But like here, back in the UK, like if someone says they are depressed, they can even give them like leave from work to go sort it out, to go see their doctor and like to be on medication or be like on psychotherapy or like talk, anything just to help with that. So they take mental health like very important back in the UK. Back in the UK. So I've lost my train of thought. Sorry. So they take mental health very serious back in the UK, comparison to here in the US. So I'm back on the reward. So if in terms of like patients, so patient coming in with like a mental health problem, they take it very serious there in the UK, and they have like I think they do ECTs in Nigeria, electroconductive therapy, but I think I heard someone say it's mostly in the West. I don't know, I've not heard about it in the South, but you could see all those therapies they can do to help their patient, to make sure their patient mental health improves. Here in the US, I'm currently doing internal medicine right now. You see a patient coming in with like a myocardial infarction. We have what we call like a door to balloon time. So you have like 90 minutes when they're coming in with a myocardial infarction. They have to go into the cath lab. Cath lab is just like the cardiologist lab, and where they can actually go open our vessel that is occluded after having a myocardial infarction. Someone coming with like a cardiac arrest, they'll pretty much investigate to make sure that person survives. So like, I think the practice here is pretty much advanced. I'm pretty much comparing it to what I saw, what I experienced back in Nigeria, and I did my internship in NDUTH. So I'm just telling you what I experienced and then what I'm seeing here. So maybe in other centers in Nigeria is much more better. I don't know, but I'm just comparing it to what I experienced back years ago. So, anyways, here patient is coming with like an intracranial hemorrhage. You have a neurosurgeon immediately fixing it. So you can actually see like intervention in action here in the US with the practice of medicine. So I think that's actually a big reward because you can actually perform life-saving measures on patients, which is very helpful. Like back in Nigeria, patients might come in sometimes. The hospital doesn't even have some medications you need to give them, or they cannot even get like an MRI of the brain or a CT of the head to know what's going on. And or even if back then we didn't have a CT scan in the Colombian hospital, so they had to send them to like I think Silhouette or somewhere in UPTH to go get it done and bring them back. Only that transport, they can have a cardiac arrest just for transportation, or before they get back, whatever has been happening might have progressed. So I think here you can actually see intervention in action, and then you can actually know that you're actually helping your patient and doing better for your patient. So I think that's actually rewarding because you can help your patient to get better, and then most patients here are very happy once you do stuff like that for them. And so I think that's very rewarding for the patient. So I think for me, interventions to help patients, because that's why we are doctors, right? You want to help patients. You want to see them get better, and that's why you're training for 6 years or whatever, with Nigerian situation, to help them get better. So you want to make sure that what you learned in school helping to save human lives, and also then the monetary benefit is also there by practicing our work. So it always depends on you what you want, but I think it's actually rewarding for me. And then here in the US, we actually have like lots of conferences you can go to meet people. If you do research, you can present it. So those are kind of like opportunities that you're kind of like um, have access to here, and then you can also get grants if you have like good ideas and you can be developed to something. There are always, you can always apply for a grant like hundreds of thousands of dollars and get that to work on whatever idea you have. They actually support that here, so they support good research here, and then you always have access to good resources. And the good thing here, if they don't have a resource in a hospital, they immediately fly you. There's kind of like an aero care. They bring like an helicopter and then fly you to somewhere else that you can get that care you need. So it's once you have an emergency condition here in the US, you pretty much, even if you don't have insurance, you pretty much have access to whatever you want to make you get better. And then once you're discharged, they can talk about the billing part. It's different from Nigeria. They're going to tell you, oh, you have to pay this amount or you have to get those medications. No, here, once you come in, the hospital provides everything, even meals. And also like hospital dresses for you, so you can just come in with a cloth and then you're pretty much going to be fine throughout your hospitalization. Even if you're going to be in the hospital for 1 month, they're going to feed you for 1 month, they're going to clothe you for 1 month, and then provide all the medications, any surgery you need. Even if you need blood transfusion, you don't have to call a family member or anything like that. Everything is going to be provided there in the hospital, like there. And don't get me wrong, sometimes there are shortages of medications and stuff like that. They pretty much try to improvise. There are always like multiple alternatives, and if for any reason they don't have what is required to manage that patient, they always transfer that patient to a better facility, and they try to do it like the safest way. So those are things, I think those are like kind of like also some differences practicing here in the US, and also comparison to Nigeria. Rule of divine direction. It's I would say it's down to you and your God, and God. So pretty much, first of all, making that decision. Okay, I want to go to this country. I feel that okay, after I graduate from medical school, um, I don't want to stay in Nigeria. I feel I want to practice in a better environment for whatever reason you have. And I think you can pray about it and then pray pray that God should help you. And like I said, I know like the financing of the exams, it's kind of like quite expensive for the US. If you have support, is much easier. If you have support, however, doing it alone might be kind of very difficult. And so, like praying, handing over your experience to God, whatever decision you've made, handing it over to God and saying, this is what I want to do. God, help me, and also provide helpers that would support me through my journey. I think it's very essential. Essential in your whole process. I had kind of, when I was going to the UK, pretty much what I did, the wise decision I made was I started early, and which is kind of like I would advise everyone on this call. If you want to go abroad, I'll tell you, make that decision as early enough, even if you're in first year, second year, and third year. And just so you know, for the US, you don't need to graduate from medical school to start writing the exams. You can start writing exams in medical school. So you don't have to wait. I think for the UK, you have to wait until you graduate because you need your medical diploma. That's your certificate you get after graduation to apply. I think you have to upload it before you can apply for PLAB 1. But for the US, you don't need that. It's only when you want to apply for the match, which is the whole residency application process, then you need to have graduated in your medical diploma. But to start step 1, step 2, you don't really need to have graduated from medical school. I've heard about a few people who started studying for medical school. I don't know how they combined medical school stuff and then the exams, but I didn't do that, so I can't talk about that. Back in medical school, I didn't really have. I started, my idea came from when I was in final year and when I was striking final year, almost to graduation. So that's when I started thinking about the whole process. But I've heard people that started studying and reaching exams during medical school. So just so you know, you don't have to wait till you graduate in case you want to go to the US. You can start your whole process from medical school. Okay, so I'm just going to be talking slightly briefly about migration pathways for Nigerian medical graduates to the UK and the US. And so why migrate depends on you, which I've talked about. I'm going to be comparing the UK and the US, key requirement, cost breakdown, timelines, and final tips. So let's talk about the UK first. So first of all, if you want to go to the UK, like I said, you have to have graduated from medical school. You can't start your whole project. You can do your whole start maybe from intern year or maybe from final year for your IELTS, but note that your IELTS or OET expires in 2 years. So anything you're currently doing, know that you have a timeline if you start early. So I started mine. I wrote my IELTS during my intern year, and why I said it's good to start early. So during your intern, most people start late, and so I know like the money is not really big, but like during intern year, you get paid like I think mine I was paid like roughly 180K during intern year. So I registered for my IELTS was 75K that year, not 260K. I was 266K right now. So mine was I think 75K. Mine was during COVID time. So that's when I wrote my IELTS. So I paid for my IELTS myself. I didn't even tell people about my IELTS because I'm like, oh, English was not really my strong subject, so I didn't really like English that much. So I'm like, okay, I'm just going to tell a few people about that. I'm going to write IELTS and I'm just going to study and then go for the exam. So I started my whole process during during internship year back in Nigeria. And then after writing my IELTS, I registered for my platform myself too. All IELTS platform was my money from that I made during intern years. So I think if that's why I'm advising you start early enough, because once they start paying you from, I know we have various responsibility, various family responsibilities, and it's like life event comes up sometimes, and so maybe even if you plan for something else happens. I pray that doesn't happen though, but we can't. Life is unpredictable. So anyway, start early. So once you start getting paid during internship, you can start financing at least. Even if you don't cover all your exam, at least you can start from somewhere. That's my biggest advice. So I paid for my IELTS, passed my IELTS, and then I paid for my PLAB 1, traveled to Enugu, wrote my PLAB 1, passed my PLAB 1, and I registered for my PLAB 2 myself, too, with my money. So, and all those were gotten from my savings from internship. But now I know it's completely different because like the exchange rate, I think PLAB 2 that year was 875. That's what I paid. And when I converted everything, I paid almost 600K for PLAB 2. But right now, I know PLAB 2 is almost 2 million if you convert it. I'm not sure what's the conversion rate right now in pounds. So, but it's completely different right now. But at least you can, during intern year, if you save enough, you can cover your PLAB 1 and PLAB 2. That if you want to do the UK route, you can cover your IELTS and PLAB 1 route with your money. That's if you pass all the exams once at one attempt. So you don't, because I know like IELTS is 266K. That's almost like a month's salary. So if you pass all the exams, that's your intern year can cover IELTS and PLAB 1 and possibly also get some money for PLAB 2. So, well, for the UK, IELTS or OET first, they are just English tests. And then for the IELTS requirement, you have to get overall of band 7.5 or at least 7 in all. There's reading, writing, listening, and speaking. You have to get at least 7 in each of those, and overall when they total your final score, it should be 7.5. If for any reason, even if you get a score of 8 and then you get, let's say in speaking you get 6.5, you have to retake the IELTS. So you have to meet the minimum. So the minimum was 7 in each and then 7.5. I think for OET, if I can remember, because I had to write OET for the USMLEs. I can't remember what. I think it has to be 350. You have to I think the OET has to be 350 across board, and 350 across board, and then in writing had a lower score. I think for doctors writing. So I think I can't really clearly remember, but I think for I'll talk about that when I'm talking about the US. This is PLAB. So anyways, PLAB 350 across board for the UK, and then for IELTS it has to be overall 7.5 and at least 7 in all. And then after IELTS, you do your register with the GMC Council and book for your PLAB 1. And then after PLAB 1, you can write your PLAB 2. The good thing is that even if you've written your PLAB 1, because I know getting dates from Nigeria are kind of difficult, after writing your PLAB 1, even if your IELTS has expired at that time, you can still write your PLAB 2. it doesn't mean you have to have an active IELTS before writing your PLAB 2 or OET. However, after passing PLAB 2, if you want to register with the General Medical Council, you have to have an active IELTS or OET. At some point in time, they extended that. I know it was supposed to be 2 years validity. They extended it with 3 years, but I don't know if that's still attainable right now. But I know some people last year, even if their IS were up to like almost 3 years, they allowed them to register with GMC. But I know IS expires in 2 years. I don't know if they've changed it back to only 2 years or if they're still allowing for GMC registration if they allow up to 3 years. And then after you pass your, you get your GMC registration. For the UK, there are multiple options. So first of all, I did one, which was I went straight into residency. So there's called an MRSA exam. That's a free exam that is, we can write it in Nigeria, but I think there are only like 3 centers: Lagos, Abuja, and Kaduna. I don't know if there are more centers right now. It's just a objective exam, multiple choice question exam, and then depending on your score, you can apply for multiple specialties. Depending on your score, you get matched into a specialty. So the exam, you don't have to, it's a free exam, but you don't only have to pass, you have to pass very well, because remember, it's kind of like it's a position thing. So let's say 4,000 people write the exam and there are 1,000 slots out of 4,000. So if you're not in first 4,000 based on your score, you won't get a slot. That's how it works with the MRSA exam. It's a MSRA exam. It's a multi-specialty recruitment assessment exam. So if you want to go through that route, that's good. It's a free exam. You can go straight into residency. The easiest specialties to get into in the UK, based on the exams I know for sure, are psych, GP, and O&G. Right now, it's slightly more difficult because many people are writing. In my time, it was very easy to get into. Like, you have to pass, but like the score right now that I'm hearing to get into that kind of far higher than what it was back then. So you have to score very high in that exam and you can get into residency straight. If that doesn't work, you can also apply for private jobs or the NHS. NHS is the National Health Scheme. For the UK, that's kind of like the government part of the UK, and there are also other private jobs. It's becoming more difficult nowadays, so ahead, not to scare you, people are still getting jobs, but then there's a way to apply for jobs. So apply for jobs, and then you get your skilled worker visa, and then you migrate to the UK. So that's pretty much a summary to the pathway of the UK. So cost, pretty much forget about the pounds for the IELTS. I think it's 266k, and OET is roughly 315 pounds. You have to convert that. I don't know if there is a Nigerian amount you can pay for the OET, but I'm not sure. Then PLAB 1 is 255 pounds, and PLAB 2 right now is 934 pounds. After your GMC registration is $161 to get registered with the GMC Council. The GMC registration is like MDCN license fee. Like after finishing internship, the amount you pay to get your full license, that's kind of like the GMC registration fee, £161. So it's kind of roughly about £1,530. You can subtract the GMC registration or just leave it there. So about £1,530. Now note, for PLAB 1, for IELTS, you can write it in Port Harcourt. PLAB 1 there, I think there's Enugu, Abuja, Lagos. I'm not sure if there are any Port Harcourt. I'm not sure. I think there were only 3 venues you can write the exam back then. I'm not sure right now. But in PLAB 1, you can write it in Nigeria, but PLAB 2, you have to travel to the UK. So this fee doesn't include the cost of you traveling to the UK to write your PLAB 2 exam. So that's pretty much completely different. This visa and IHS fee, forget about that. Flight miscellaneous to going to the UK, roughly $700. So for the UK, just roughly budget, like I'll say 3 to 3.5 or 3.5 to 4k in terms of like flight, accommodation, everything, pounds, to go to the UK. Like writing your exam from IELTS scratch to moving to the UK, roughly about 4k pounds to migrate to the UK. So this is just a rough breakdown what you need to know about the UK pathway. So IELTS, PLAB 1, PLAB 2, GMC registration, and either write your MSRA exam or apply for a private or NHS jobs, and you get it and start working. So pathway to the US. So going slightly backward, once I got into the UK back in 2021, no, 2022, yeah, 2022, we started studying for steps, and then it's for the USMLE step one, step two. Forget about step two CK, yes, step two CK OET. Before we had CK and CS. But right now you only have step one, step two CK OET. They changed CS to OET, and then you have step three. However, note step three is not required for matching and getting a residency spot. So I left that out of here. So for step one can only be written in Ghana. That's the closest to people back in Nigeria. I was in the UK already, so I wrote mine in the UK. But step one can, if you want to go through the USMLE route, your step one and step two CK must be written in Ghana. That's the closest place to you. Your OET can be written in Nigeria, so that's fine. But you have to travel to Ghana to go write your exam. So after you write step one, step two, and OET, ECFMG certification is the next thing. That's kind of like your license to practice in the US. So it's like GMC registration, MDC, and this is ECFMG. We call it ECFMG here. So after writing step one, step two, CK, OET, you can apply for ECFMG certification. And after that, you can then apply for the residency match. That's the common thing you hear, match. So the match is just how does it work? So you apply to like it's completely different from the UK system. So you apply to like the whatever specialty you want, and there are different programs, and then whatever amount of programs you want, you send your application. You have to pay to apply to those, just like looking for a job, but you pay for applying to like a hospital. So let's say you apply to 100 hospitals, and then the hospital reviews the several applications they get, and they decide to give whoever they want interviews. So now after the interviews, depending on how you perform, there's how you have to rank them from where you want to where you don't want, and they also have to rank you from who I like to who I don't like, or to who would never match in my program. And then they put it into a system, and then based on how a system does the matrix, and then you do, that's when the match you hear. So people get matched. For some, most people, I would say most people, I would say about 50% or more get matched, and then some people don't get matched for sure. Not everybody can match. That's the whole US process. So after the match, then you start your own visa stuff. Now, step three, like I said, can be written before, but note step three can only be written in the US. You can't write step three in the in Ghana. You have to travel to the US to write step three. But many people take their step three when they start residency. Before they get into second year of residency, they take step three. But I wrote mine before I started residency because I could travel from the UK to the US. I wrote all my exam before I started residency. So cost. So step one is about like $1,195. Step two CK is about $1,250. OET in this is in dollars, $455. Your ECFMG application. So before you even start all your registering for step one, step two, you have to do an ECFMG application. That's about $160 before you can get your ECFMG ID to apply for step one. And then your step two CK, that's the fee. Sorry, is repeated. And then travel and lodging, it might not be up to $2,000, but you have to consider your fee to Ghana, to and fro accommodation, and also for I didn't talk about what you need to prepare for the UK exams. There's what we call for PLAB 1, there's what we call PLABable, and for PLAB 2, there's what we call, you have to go for an academy. Most people go for academy, some people don't. I did an academy, so I encourage people to go for an academy. It's helpful, but some people risk it and don't go for an academy and just study on their own, and they pass the exam, but some people end up failing. But even if you go to an academy, you can still fail the PLAB too. So I'm not saying if you go to the academy, you're going to pass the exam, but then people that go to the academy have higher chance of passing the exam, because PLAB 2 is more of like a clinical exam. You're kind of like, you're acting. There's like a simulated patient there that you take history from, examine and stuff. So it's like a clinical exam where you talk and they assess you based on that. PLAB 1 is written, or PLAB 2 is more of like a clinical exam. Coming back to the good thing with the step exam, all the steps exams are pretty much written exam. The only thing you're speaking is during your OET speaking session. If not, all the steps exam are pretty much written exam, so you don't have to do that clinical exam where you take history from patient. You don't have to do that. But then, in summary, it seems the US, you spend more money in terms of like the whole exam fees, roughly about, I'll say 6 to 9K. But that depends on the amount of programs you apply for. It can be more than this. For sure, I spent more than $10K doing my whole US process because of the amount of programs I applied to when I was applying for the residency match. So just a slight comparison, I know I'm running out of time. Exam difficulty, I would say the US is more exams are more difficult than the UK exams. PLAB 1 is pretty much straightforward. You read the question bank and pass recalls. You pretty much get through the US exams. I don't even know if they are recalls, to be honest. And then there's what we call U Word you to practice for US exams. Even after using the U word, you don't even see repeated questions in the exam. With PLAB exam, you see repeated questions, and for PLAB 2 exams, like there are 300 stations which you need to just cram, and then you have 16 stations in the exams. Out of that 300, your 16 or at least 14 or 15 are coming from there. So the UK exam, like PLAB 1, you definitely see repeated question. PLAB 2, you're gonna have repeated scenarios that you've practiced during your study for the exam. But the US, you will likely not see repeated question from your question bank, but it's still the same principle to answer the question. So the exams are slightly more difficult. So you will fail in these steps more, but don't be scared about that. You can pass the exams. You just need to study and have the good resources to pass the exams. Cost kind of slightly lower in terms of UK and higher in the US. Duration of the exams, I would disagree with this. This is kind of like general for most people, but I would highly disagree with the whole duration. My whole UK process, I'll say my whole UK process was even longer than my US process for me, because I started in 20 during my intern year, then I did NYSC, but at the end, so within 2 years, it was less than 2 years for sure, because I think it was kind of like April, and then by the next year, October, I already got in the residency slot. So I would say like roughly 15 months, I was done with my whole UK process. But with US, I was done with my process like roughly about a year. I rushed all my exams, which I don't advise anybody to do, but I rushed all my exams. I wrote my 3 steps within like roughly 6 to 8 months, and then I applied, and then I matched. So it's different for different people, based on like finances. Like not everyone. I work in the UK already, so I could afford my US exams, so it was pretty much very straightforward to pay for whatever I needed. But people coming from Nigeria, you may not have support. People have to stay for like 1 to 2 years to even apply for the match and also pay for the exam. So like that might actually prolong the duration of time before they apply for the match because of the finances, not because of the exam. But yeah, so that's pretty much average for most people coming from Nigeria. Process after you apply for a job or write MSRA after PLAB, and then you apply for the match after the US exam. In the UK, it was favorable before. Right now it's becoming competitive. I would say the US is definitely for sure competitive. For sure competitive. Like the whole match is very unpredictable. Even if you get up to 10 interviews, some people end up not being matched. So it's pretty much very unpredictable. But don't be scared, you can do it. Visa type, I'm not going to bother you about this when you get there. Final tips: plan timelines for your exams. Visa and plan start early. Both parts are expensive, but like I said, make up your mind very early, and then like hand over your whole process to God. Pray for helpers and people to support you. If possible, I know it's not easy to get US or UK clinical experience. For the US process, there are lots of things that I left out, like research and like having US experience and clinical experience during before application. Those are stuff you need before you apply. So I'm not going to talk more about that. And then especially for the US match, you have to research programs, because not all programs will accept IMGs. IMGs are international medical graduates, like I and me and you. We are all going to be international medical graduates. We are not American medical graduates. And then guideline often change, so you have to make sure whatever process you are on, like try to keep you definitely don't do anything on your own. Keep in touch with people that have gone through the process and people that are currently going through the process, because things often change, and so like you need to be updated on what's going on and if what's obtainable at this point in time. Because like by next year, when I was writing my step one, I wrote my step one back in 2022. They People had scores in step one before I wrote mine was just pass and fail. So I just needed to do pass and fail. So things are changing. So you need to know what are the recent changes in all the exams and just be updated with as the time goes by. Just to slightly touch about this, for the US, there's kind of like a slightly new pathway. I'm not too familiar with this, but only some states has approved this. I'm just going to summarize. So Tennessee for sure, Illinois, Florida. So what this means is just that. So some people that are consultants back in Nigeria, if you get someone that can employ you, you can practice supervise for 2 years in mostly an underserved area, kind of like a rural area, and then you can be allowed to practice even if you don't have, even if you've not written the USMLE exams. Some states like Arizona wants you to have written the exams, even, and then you don't need to go to residency here in the US. You can just do your residency back in Nigeria, wherever you are from, and then um, come to the US, see somebody to supervise you for 2 years, and then they allow you to practice unsupervised, like an attending here. But some states says you don't even need to do the exams. You just need to get someone that can employ you as far as you're a consultant back wherever you're from, and then you're going to practice supervise for 2 years, and then after that you can then, if you're signed off, you can then be allowed to practice independently. But this is kind of something new. It's something like that's been here like late last year, this year, and but I've not really seen anyone that has been doing this. But this is just something that you can be aware of. That doesn't mean even if you don't write the USMLE exam, you can't practice here. Some states now are allowing people that have trained abroad. If you see the issue with this pathway is that it's going to be difficult because most people want to use people that are maybe citizens or have green card. But if you see someone that can sponsor your visa to come here to practice supervise, it's also an alternative for graduates, like international graduates, like both of us, I and you guys. So I think yeah, that's it. Also, I've been talking for almost an hour. Any questions? For now, let me close my screen and so I can see the chat box.
Wow, thank you very, very much, sir. Thank you. Can we send our love emoji to him? Tell him thank you for such an insightful presentation. My God, it's so, so awesome. Please, if you got questions, you can type your questions in the chat box also. You can do that right now. I know you have a lot of questions. Please do that right now. It's important you ask your questions right now, right now. Please do that. So thank you very, very much. We are happy to have you. We're happy to hear you from US. Having someone to talk from from two parts, from UK and also the US, and also understanding the background we are currently in Nigeria. So, so, so awesome. Not to waste time, we have some persons, some dignitaries, use the word dignitaries here. We have Dr. Taboe Michael with us and Dr. Oloma. Thank you very much for joining us. They are also our speakers in time to come. So we're happy to have them with us this evening. You're welcome, sir. You're welcome. Please, you can drop your questions quickly.
Okay, so I'm seeing the questions for from Douglas. How can we get proper information on how to register for the USMLE? I think for that, I'll just drop my number on the chat box. You can chat me up and I can just give you an idea of how to go about it. If you're sending me a message, please introduce yourself. Don't just say hi because I don't respond to hi messages. Just say, oh, I'm this, and then I'll respond. But if I just say hi, I'm unlikely to respond to that message. So just send me a WhatsApp message. Yeah, so send me a WhatsApp message. And then just I can tell you more about the USMA. But it's pretty much very straightforward. You go onto ecfmg.org and then try to register to get an ID. They will tell you to put in your information, and then you pay $160. After that, they'll tell you to do a notary. It's going to be an online notary thingy. I think you have to pay roughly $100. I don't know any other ways to do that. It's just to pretty much hold your passport and swear that, okay, this information I provided are correct. And then after that, you're going to get your ECFMG ID. After ECFMG ID, they might ask you for your transcript and other stuff like that, which you have to get in touch with the school. They'll tell you, they'll send your transcript to them, and then after approving all those, you're pretty much good. But I don't think you don't even need your transcript initial part of the ECFMB registration, because I did mine later on. But the initial part is the main thing is fill your information, pay your $160, do your notary, and then you get your ID. And then after you get your ID, you can. The good thing with the US exams is that whenever, if you wake up tomorrow and say you want to write step one, there's always an availability for you. It's not like PLAB that they write the exam like 3 to 4 times in a year. They write step one, step two, and step three every week. And it's not same question. You have like a large question bank. So don't someone writing today and you writing tomorrow, you might have maybe 5, 10 questions together, but it's mostly different questions. So yeah, you can write. You can pretty much whenever you're ready, you can take your USMLE exams. How feasible is it for an IMG to match into competitive specialties like ophthalmology, anesthesiology, ENT, or radiology? Well, in the UK, I would say it's the UK. So in the UK, I also tried to also apply for radiology at some point with the MSRA exam. But the issue I had with that was after writing the MSRA exam, there was another session where you had to bring kind of like proof of there's a score over 10 where you kind of like have to show proof you've done research, you had experience in radiology. And most people from Nigeria, we don't really have all those experiences. And I had kind of like had a short timeline to even get anything. So in the UK, I would say it's difficult, but I wouldn't say it's not attainable. You can achieve that, but I think you have to put in a lot to get that from the UK because there are only a few slots, and then you're competing with the US the UK graduates. In the US too, same thing is applicable. Like I have a friend in anesthesiology that matched. He had good scores, but the funny thing, even if you have good scores in the USMLE, that doesn't guarantee you a spot in any competitive specialty. No, it doesn't guarantee because most of those competitive specialties they reserve it for the US graduates. Anyways, to match into very difficult sports like ophthalmology, anesthesiology, ENT, radiology, I would recommend you have to come to the US to do like a clinical rotation and get a letter from there. Let them know you, let them see you, and then it's more easier. And then you have to also get good scores in your step. You can't have average scores or you can't have like an attempt in a step. And one thing with the US, if you have an attempt in any step exam, that's kind of like a red flag for your application. To always when you get your license, ECFME certificate, it's going to show that you repeated an exam twice, and it will tell that you failed the exam, what date you wrote, and you failed the exam, then the next time you passed the exam. So you can't have a repeat attempt on any steps if you are going for a competitive specialty. But to be honest, let me be frank with you, is highly competitive to get into any of these. Here in the US, the ones that are pretty much straightforward to get into: internal medicine, family medicine, pediatrics, and then psychiatry and pathology are also slightly IMG friendly, IMG International Medical Graduate. So IMG friendly, those 5 specialties. The rest are pretty much very
Please, can you say them again?
sorry.
The friendly ones. Can you say them again?
So internal medicine, family medicine, um, pediatrics. Those are kind of like pretty much easier, and then slightly still easier but more difficult than these other three: psychiatry and what was the last one I mentioned? Pathology. So those 5 specialties. Another question: apart from UWorld, what other study materials are needed for USMLE Step 1 and Step 2? So um, I've heard different stories, but I'm going to tell you what I used. So I did first aid. First aid is like a very big book. I did first aid. For step 1, I did first aid. For step 2, if you've studied first aid already, you don't need to do first aid for step 2 because the good thing is kind of like it translates to from step 1. It helps the knowledge you get helps you for step 2, but step 1 is mostly basic science like anatomy, biochemistry, genetics, microbiology, pathology. So it's pretty much like preclinical. Step 2 is more clinical, but you need some knowledge from step 1. So for step 1, I'll say first aid. I use only first aid and UWorld. Now, there are some online videos that help people with pharmacology and stuff, Bots and Beyond, Patoma. I can always share you links to that if you chat me up. But yeah, people use that for step 1, but I only use first aid and UWorld. For step 2, I only used UWorld for step 2. Pretty much nothing. And for step 3, just UWorld and what we call CCS cases, because there's step 3 is into 2 sessions. Your main written part, and then there's another clinical scenario part, which is still written computer based, but it's like they're giving you patient, you're managing your patient from when the patient comes to the hospital to discharging the patient, and your patient can die on the computer. But that's step 3, but that's kind of like down the line. But for step 1, step 2, first aid, UWorld, Patoma, Bots and Beyond videos can help. For the matching in the US, the highest matching is of internal medicine from what I've seen about other departments like family medicine, orthopedic, pediatrics, and other what are the highest match rates for other departments apart from medicine? So I said apart from internal medicine, family medicine, pediatrics, and you have psychiatry and pathology. Also, for the visa types, I would really like to know about it. For the visa types in the US, so the US is slightly very different. So for mostly they give J1s, and J1 is kind of like a student visa. Um, there's also another visa called H1B, which is kind of like an immigration visa. Now, the um, only few hospital sponsors H1B because there's a lot of legal stuff involved with that. However, the only way you can get an H1B visa is if you have your step 3 before application, like when when you matched, like so before March is usually in March of every year, so you have to have your step 3. That's the only way you can get your H1B. If you don't have step 3, even if you have a program that sponsors H1B, you can't get an H1B visa. So most people get J1s, and then only J1 and H1B for immigrants like us. Then the rest people, if you're a green card or a citizen, you don't need any visa sponsorship. Locations to write OET in Nigeria. I think I know my brother wrote in Lagos. I think there should be a center in Abuja, but I'm not sure of any other center. I did not write my OET in Nigeria. I wrote my OET in the UK, so I'm not sure, to be honest. But I think if you Google, you should be able to find OET centers in Nigeria. But I'm sure Lagos and Abuja, those are locations for OET in Nigeria. Someone like pediatrics. Yeah, I don't like pediatrics too, so also that's not going to be a specialty I would consider. So if you become a consultant in the UK, do you still have to write your seminary to practice in the US? Yes, you still have to. Um, Unfortunately, I don't think the US and the UK have kind of like an understanding that if you train in the UK, you can just go practice in the US. No, I know US and Canada has that. So if you train in Canada, you can practice in the US, and if you train in the US, you can practice in Canada. But in the UK, no. The only way you can do that is if these newer things I talked about towards the end, and if you find someone that can supervise you for 2 years, and then after that, yeah, that can work. But you can't just train in the UK. Like, let's say I finished psychiatry. I didn't finish psychiatry. I left in between psychiatry back in the UK. But let's say I finished psychiatry, and then I wanted to come here to the US to practice. No, I can't practice in the US. No, it wouldn't work. And what's the feasibility rate for surgery? You mostly talk about internal medicine. How competitive is it? Are they the same pathway? So yes, all pathways are the same for the US. You write the same step 1, step 2, and OET. The only different comes when you're about to apply. You can apply for whatever specialty you want to apply. What's the feasibility rate? Unfortunately, it's very, very, very competitive. Even the US graduates, most of them go on match for surgery, but then few Nigerians have matched into surgery that I know, but just very few. Like if 100 applies, less than 5 matches, or maybe a little above 5 matches. Except for some reason, maybe they are citizens or something like that, or they trained somewhere else, or they went to do a rotation there or something like that. But it's still, that rate is still very low for matching into surgery. Even internal medicine, to be honest, is still competitive. Most people still go unmatched. Most people still go on match in internal medicine, so it's still very competitive. So let's say I think I don't know of the number, but I would say the match rate was about 40 to 60% for internal medicine. So it's not still like very great, like 80%, 90%. No. So even internal medicine is still difficult, but it's kind of relatively easier comparing to other specialties. And then someone said, I've heard about sending recommendation letters from your previous lecturers in the department to increase the chance of matches in the US. So, well, truth be told, letters that are, so the truth about, so when you're applying for the US, there are lots of things involved. You need recommendation letters. Yes, you also need research, and also need some volunteering activities. However, getting a letter from Nigeria, they don't even know, they don't know most people in Nigeria, they don't even know most hospitals. So, but the advice, getting a good letter is better than getting a letter from like me in the US and then just writing rubbish, like just very generic letter. So they prefer like a very good letter for someone that's worked with you before, telling them about good qualities that you can offer to the program. So yeah, that will help. But to be honest, they prefer letters from places in the US. But then if you're applying for residence, I got letters from Nigeria when I was applying for my own residence. Even if I was in the UK, I got a letter from the UK, and I got letters from some of our lecturers back there, NDTH, where I did my internship. How were you able to prepare for USMLE? To be honest, I would advise people don't do what I did, because I did a kind of an unconventional and risky um preparation for my exam. So like I got to the UK, and then that same month adjusting to like a new healthcare system, using like just completely different. I started studying for USMLEs that same period, and then I wrote my step one in within 4 months. I advise you at least for step one, study for 6 months, so you don't feel like I told you. You don't want to fail. You don't want to fail any of your steps, because if you have an attempt in your steps, then it reflects when you get your license. And once program sees that, it's kind of like a red flag in your application, and it significantly reduces your chances of matching. It doesn't mean you can't match. People that have had with attempts on steps matches, but it reduces your chances of matching. So how was I able to prepare? I would say I just prepared. I was going to work, coming back, tried to study, going back to work again. So it was kind of like, I would say it was stressful, but I just gave it a shot. And then for me, I wasn't really too bothered. I wasn't really too bothered about the whole USMLE process, because it was kind of like my whole USMLE process started like kind of like a joke. Someone encouraged me to just do it, and I was like, okay, let me just try it out, because I never had planned to go to the US. I was already in residence in the UK, so I was like, I had nothing to lose. So I'm like, okay, if I write step one and I fail, um, it's just gonna end there. So I was like, I was even hoping when I write I was gonna fail, because then I knew then I won't have to do step two, step three, and all the whole residency application process. But well, God had it. I passed step one, so I had to progress step two and whatever. But anyways, so I pretty much, it was kind of stressful, because I was going to work and then studying during the evenings. I don't study at night. I don't study into the night. So it was only when I get back from work I could study. So I was pretty much combining both of them and doing as much as I could whenever I get a free chance to study. And that's how I studied for my USMLE exam. For step two for me was much easier, because it was more of like a clinical exam, and I had written PLABs already. So that was pretty much straightforward for me. But then I did like my step two preparation in like roughly like less than 3 months for my step two, because I was still preparing for step two and also OET. My OET exam, so I was pretty much carrying like too many things together. But I'd done IELTS before, so OET was not too difficult for me. Writing OET, so that was pretty much very straightforward. And then step two for me was pretty much, I could relate to step two more than I could relate to step one, because step two was more clinical, and then step one was more like taking me back to biochemistry, pharmacology, microbiology, and all that stuff that I have pretty much forgotten. So that was more difficult, in my opinion, than step two. For me, step two was pretty much very straightforward. Is there a way to get UWorld for free? So there's an offline UWorld for which I used in my time, but then I would advise you, if you're starting early parts of preparation for USMLEs, you can use the offline UWorld. It's kind of like screenshots of, it's on Telegram. If you chat me up, I don't have Telegram on my laptop. If now, like, I could have gotten a link, but if you chat me up, I'll put my number at the end again in case it got mixed up with the whole messages. I can send you the link to Telegram. There is a free UWorld there, and then it's kind of like a screenshot and then the answers later. So that's what I used to study for my step one and step two. But then that was since 2022. So I don't know. I don't think there's an updated version. And then there are more, if you do the paid UWorld, there are pretty much more updated questions that would help you in studying for your exam. So I would advise, if you want to start, you can use the offline UWorld and start studying. However, close to your exam, maybe 1 month, 2 months, 3 months to your exam, you can do the paid UWorld. Most of the questions will still be similar, but then you will see new questions and new things they are trying to assess. Like pretty much in the UWorld, they actually, how do they call this? USMLE exam, they pretty much try to assess different things. So you might not get exact questions, likely not exact question, but they are assessing the same, like let's say they're assessing what's something easy. They're assessing diagnosis of a myocardial infarction. So they can just be, it's still the same thing, but they're going to rephrase the questions in different ways, or ask something related to myocardial infarction, but completely different from what you studied in your UWorld. But once you're using your UWorld, you should be able to get that answer. So pretty much that's how I advise you. So you can use offline UWorld for the first time, and then close to your exam, use online and paid UWorld. what's the scoring pattern and possible cutoff mark for step 1 and step 2. So I think I think for step 1 now, step 1 is pass and fail. Pass and fail in step 1. I think the cutoff mark for step 1 is 200. Now I don't know what is over. I think it's over 30. The max you can get is 300, but nobody gets 300. But I think, yeah, in my time it was 198, but I think they increased it by 2 points. Now it's 200 for passing score of step 1. So 200, you have to get step 1 to above 200, then you pass. Step 1 is just pass and fail. For step 2, I think it was previously 208, but now I think they increased the passing score to 214. So 214 is the passing score for step 1 and step 2. And for international graduates like us, for a step 2, I advise you getting at least 240. 240 is an okay score. If you can get more, 250 and above is a good score to get into residency in the US. 250 and above is a good score. So that's pretty much for the scores. Are CME points helpful in match rating apply for residency in US? I don't think they're helpful because they don't ask for CME points. You can I don't know how you can put it on your application that you even got CME points. You can put, you definitely have in your application, you have chances to put experiences like, oh, I presented this or attended this conference and what you learned, but not the CME points. So no, they're not really helpful, I would say. Does completing residency program in Nigeria, our home country, have any benefits or positioning and chance of getting a good job in the US or UK, or are we having to restart residency program again in the US or UK? Good question. So in the UK, I would say if you're looking for like NHS jobs or like private jobs, having like done a previous residency program can help. But in getting into like via the MSRA route, I don't think it has any role, because for the MSRA route, which is the exam you write to get straight into residency, that one, it's your scores that depends. So whatever score you get, that gives you a spot. So even if you're just fresh out of medical school today and you take that exam, if you get a very high score, and maybe me that I'm done with residency or whatever and get a low score, that person will get a spot first than me, because it's based on a ranking system. Like I said, your score gives you a spot based on the amount of spots they have. So in the UK, unlikely, but if you're doing NHS route or private jobs, yes, it might help. And then there are also, like, I know for psych, but those people had to still write PLAB, but then some people, I know I had a friend back in the UK, she was a psychiatrist in Nigeria. She got how they call like a senior registrar spot. They call it higher training role in the UK. So only some specialties allowed that. I know psych allows that. I don't know about internal medicine, but if you've done a previously residency in your previous home country, you can, after writing your PLAB, you can, or even without the PLAB, some people take you and give you GMC registration. I know some people that don't even write PLAB, they take you and give you GMC. It's called an international IMT role. International medical training role. So some people get that, but it's only like for psychiatry and some few specialties, not multiple specialties. For the difficult specialties, I don't think they will even allow you to do that. For the US, if you've completed the previous residency, if you're applying, it helps because you can talk about it in the interviews. But then another issue with the US is that the farther away from your year of graduation, the more difficult it is for you to match. So let's say, for example, let's say I'm applying. So the next people they're going to start application season July, ending of July, and then people would match next year. So if for any reason someone graduated last year, that person would have higher chance of getting an interview and matching than someone that's graduated 5 years ago, than me that graduated 5 years ago. I graduated in 2019. So I am classified more than 5 years post graduation is classified like old IMG. Some programs don't mind that. Some programs will put it in their program description, or we prefer to have less than 3 years of graduation. So if for any reason you're having a residency program in Nigeria, yes, that shows that, okay, you were still trading there, so that might not count because you're an OIMG. But some programs it helps, some programs they might not like you because they'll be like, oh, you've graduated since, and something like that. So yeah, I would say it has its pros and cons. So it's not completely ruling you out in both countries, and it might not also always be helpful. And so most people come. Do we have to restart? Yes, most people come here to restart residency here in the US. They write the steps and they start from intern. And the thing in the residency here in the US is your first year of residency is intern year, so you have to come back to do intern year all over again. But it still counts to your first year of residency, so no one cares about that. So even if you're having like a 4-year training or a 3-year training, your first year is always your intern year, and then you just have 2 more years and you're done with it. But yes, you might have to come restart again from the scratch. And I think that also applies to the UK, depending on the specialty that you did in Nigeria. If you're like a neurosurgeon in Nigeria, I don't think anyone will want to take you in the UK for neurosurgery, because I think it's completely different. So you might have to restart again. Is it possible to write both PLAB and USML at the same time? Well, it depends on you. I don't know how you want to divide your time. You might be working, except you're at home and studying for both exams. So I don't know how you want to do that. It might be possible, but it depends on your study pattern, to be honest, because both exams are completely different. So I don't know how you want to combine that. It might be quite difficult if you're only studying and you don't have any like job you're doing, which is highly unlikely. Even if you're in Nigeria, whatever country you are in, it's unlikely that you're not working, because you have to finance your exams, right? So it might be very difficult to write both exams at the same time. Someone said, how about going via the master pathway? Is that possible? So master pathway where, the truth be told, even if you go to the UK, you do your masters, it only, you're in the country, you still have to write your PLAB again. The only thing that helps is that with PLAB 1, you don't have to fight for dates like people fight in Nigeria. There are almost always free spots in the UK, so you can easily get PLAB 1 date, and then if you're in the UK already, you can easily write your PLAB 2, because you're in the UK. You don't have to travel again, because compared to the people in Nigeria that have to travel to the UK for PLAB 2. So, well, that helps if you're already in a country. And then possibly you can do some rotations and then apply to NHS. So that might help if you're doing the master and ideas of clinical rotation. So helping to get a job, yes, it might, but it doesn't entirely, like, it just helps. Like, there are some pros and also like cons, is that you're doing masters and then you're paying school fees, except you go through scholarship pathway, then that's fine. During your master year, you can easily do PLAB 1, PLAB 2, do some clinical rotation and get a job. So that's fine. For the US, the only advantage I would say is when you're in the US doing your masters, the only thing that will help you to do is that you can write your step 1, step 2, which you can also do in Ghana, so that's not really helpful. Step 3, you can only do it in the US, so yes, you can write your step 3 here in the US, so that master pathway helps with that. And then also you can do clinical rotation. Like I said, clinical rotation are very helpful here in the application for a residency in the US. I did an online rotation. It's called a tele rotation. Like, I just paid, and then it's kind of like I watch people doing just kind of like a tele visit and stuff. So I did that to get a letter. I didn't come to the US to do a rotation, but they prefer if you are in the US to do a rotation. But if you can't be in the US, you can do that tele rotation. That's fine, because of the visa thing and the cost and everything. I did tele rotation back from the UK. But yeah, if you're here in the US doing a master, you can always do your tele rotation in person and get letters. So yeah, that's how it's helpful. But apart from that, I don't see how some programs might like people that have MPH, maybe because maybe they might be good in research and stuff like that. But apart from that, I don't really see much advantage. What's the number of questions and allotted time for USMLE steps? So I think step 1 for sure is 7 blocks, 40 questions. So 280 questions. I think so. Step 1 is 40 blocks, 280 questions. Step 2, I think step 2 is still roughly 280 to 300 questions, I would say. And allotted time. So per block you have an hour. So the USMLE exams, like, it's like I initially said, when I was comparing, it's more difficult than the UK, the PLAB exam. However, also the exam itself is more draining. So you sit for 7 hours, or it's an 8-hour exam because you have 1 hour break, but 7 hours, you can share your break in between. So how it works is, let's say you start your exams, you open a block, 40 questions is an hour for a block. Now, after finishing that block, you have an option to remain there to continue your exam, or take like any amount of minute of break. If for any reason you take more than an hour break, it will start eating into the time of your main exam. So that's how it works. So the main exam is 7 hours, and then you have 1 hour break. So it's an 8-hour exam. For step 2, you have, I think, 8 blocks. So that's a 9-hour exam, because 8 blocks of exam, and each block is an hour, and then 1 hour break, which you can share 10 minutes in between to just take a walk, go have a snack, and come back. So it's kind of like a very long exam. And also step three is still similar, just as step three is 2 days. It's a 2 day exam. How do I get the right question bank for PLAB? For PLAB, I'll advise you just join Telegram groups, and then you need Plabable. For PLAB one, Plabable would help a lot, and then there are lots of recalls on the Telegram group, and they also revise Plabable question every evening. Even if you don't want to join that, that's fine. You can study your Plabable by yourself, and then the recalls are usually in the file session of the Telegram group. So you can get it there. And then I will advise you subscribe for your own Plabable question bank, because that also has mocks that also helps very well. So yeah, that's how you can get your question bank for Plab. I think I can't remember how much Plabable was. I think my time was like $25 to $30. I don't know if it's up to 40 or 50 pounds, not dollars. Sorry, right now. But yeah, that's Plab. But then you can get the other stuff from the Telegram group, which is very helpful too. And then you can also study with people from the Telegram group. So how do you cope with the issue of race, ethnic differences between you and American patients? Is the level of racism reduced? Do you ever feel disadvantaged having first degree MBBS in Nigeria? Okay, good question. So um, race and ethnic differences between me and American patients. So I think so. Definitely, I won't completely rule this out. I won't completely rule out this racism thingy. Both in the UK and in the US. Like I remember in the UK, sometimes you're sitting in buses and nobody wants to come sit beside you and stuff like that. And sometimes you want to talk to patients, they don't want to talk to you and stuff like that. But then there's how I view it. I don't really care, because if I'm sitting in the bus, you don't want to sit beside me. I'm having a seat to sit at my back and sit on the next seat beside me, so I don't care. If I'm at work and the patient doesn't want to talk to me, well, you're saving me good time, so that's fine. Let's work. At the end of the month, I'm gonna get paid. So I don't really like the whole. I don't blame them. They might have heard lots of things, lots of stories, be it true, be it false, but like, well, it's not something I can change. So for me, it doesn't affect me in any way, to be honest. Sometimes even when you try to go into a patient's room, you see all white patients, and then sometimes they look like, who are you? And so you try to introduce yourself, you're the doctor and stuff like that. That is still there, but then I'm just gonna do my job. You can't change that. You just have to practice. So for me, it doesn't affect me. I know it affects some people, but for me, the way I live my life, that doesn't affect me, because at the end of the month, I'm going to be paid my salary. So I don't really care. If you don't want to talk to me, better for me. It saves me the 15-20 minutes I'm going to use to talk to the patient. So that's fine. I'm okay with that. Is the level of racism reduced? I wouldn't say it's reduced. It's still there. To be honest, there are some states that are kind of like, I'm in Texas, so it's kind of like a very diverse population. You have like African Americans, you have Hispanics, you have whites, kind of like very diverse Indians, Asians, and stuff like that. There are some states that are pretty much very white dominated, and same applies to the UK too. There are some like cities that in the UK that are very white dominated. So in those places, well, you might expect more, but in the other cities, like I know in the UK, like close to Huddersfield, I was in Dewsbury, close to Leeds, Huddersfield, those were pretty much better than compared to maybe towards the south, like maybe those white, very expensive and white dominated parts. Those might be, you might experience more racism in those parts of the country. So I wouldn't say the level of racism is reduced, but for me, it doesn't bother me. And some stuff that my colleagues would say, oh, that was being racist. Like, I don't, for me, it doesn't even register in my brain because it doesn't affect me. Do you ever feel disadvantaged having first degree MBBS in Nigeria? I wouldn't say, to be honest, I wouldn't say I feel disadvantaged, to be honest. But if I had a chance to do medical school in the US, I would have preferred that. Why? Because then the competitive specialties, like if I wanted to do ophthalmology, ENT, or dermatology, it's going to be very easy for me to do it if I schooled here, compared to coming from like Nigeria or any other country you're coming from. So you're actually at a disadvantage because you're an international medical graduate, and then it just that for me. If not, apart from that, I don't think I feel disadvantaged at any point. Another thing I won't feel very advantaged is that people here after medical school, they are in lots of student loans, like because most their school fees here are very, 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 very expensive, and so most of them don't residency, and even when they are attending, they still pay back their student loans. So unlike me that train in Nigeria, I don't have any student loans, so like all my salary is pretty much for me. But like any of my colleagues that did medical school here, they have student debts they have to pay off. So I don't feel I'm actually at any disadvantage. You're actually more at an advantage because you don't have any debts. The only difference is that you might not be able to get into the competitive specialties than if you train here. How about non-clinical house like MPH? To be honest, I think in the UK, when I was still there, I was hearing that there might be some public health routes, but I'm not sure how that is right now. Here in the US, the people that did public health, I'm not seeing anyone that finished. All the doctors I've seen here, they always pretty much try to get into residency because I think you get paid better, and it's just pretty much a straightforward route. If you can just get into residency, you just know that you're good for life. Like because after residency, you must definitely get a job. So I'm not sure how non-clinical routes like MPH would work here in the US. You should be able to get a job, hopefully. Yeah, you can get a job, but I'm not sure how common that is. Most doctors here I know try to get into residency. For the UK, I heard about the public health route after doing public health, but I'm not sure how that is right now. So I'm pretty much unable to comment much about that. Yeah, my contact is there. If you're given a chance to choose Nigeria, UK, USA, put it into consideration the current exchange rate, because and all things as well expensive gotten so far. What would I choose? To be honest, I think so the thing is, so let me be honest with you. Comparing my when I was in the UK and in the UK and now my US experience, I would say like the UK has better work-life balance. Like it's a small country. So even if you have a friend like towards the south and you're in the north, you can easily get a train and travel. And so they kind of like it's kind of very balanced. Like they give you a good work-life balance. They care about mental health. They don't want you to be stressed. So like the UK cares much about that. Like they are very big on that. But the issue is that when you're done, I think as a consultant in the UK, you earn about like 120 to 150,000 pounds in the UK. Now in the US, the issue with the US is it's pretty much it's like almost slavery, I would say. Like you pretty much work mostly not every week, but you pretty much work 6 out of 7 days in a week. Some weeks you just work 5 days, but most week you work six. Like this week, I'm working 6 out of 7 days because I'm in the ICU. Today is my day off. That's why I'm at home. I'm going back to work tomorrow. So it's pretty much more work hours in the US, but in residency, you don't get paid well. You're pretty much paid similar to what I don't I'm getting paid less than what I was being paid in the UK when I was a psychiatry resident when you compare what I was getting in pounds to what I'm getting now in dollars. However, the advantage in the US comes after finishing your residency training because then it's kind of like skyrocket. So like you can expect to earn about like 250 to whatever specialty you to. It can go as high as like $1 million here in the US compared to like 150 to or 120 to 150 if you're doing local, you can get up to 200k pounds in the UK. So monetary terms, the US pays better depending on the specialty. Some specialty pays you lesser in the US. Procedural specialties in the US pays better than non-procedural specialties in the US. But work-life balance, if you're big on work-life balance, you just want to be chilling, earn good money, be at peace, go for vacation and stuff, I would say the UK offers that lifestyle better than the US. Um, Putting into consideration the exchange rate costing as well expensive getting far. Okay, that I just talked about. And then, truth be told, I think things are expensive here in the US compared to the UK, in my own experience. And I've kind of compared stuffs like I was there and I'm here now. And I also speak to my friends in the UK. Things are much expensive here in the US. So, putting into consideration, those are the pros and cons. How about other routes like pathways like Australia? So, to be honest, I have a friend, one of my classmates, went to Australia. And in fact, two of them are in Australia right now. What I know is that you have AMC 1, AMC 2. After AMC 1, which you can write in South Africa or Philippines, you can get a job, but it's difficult. However, if it's the easiest part is after writing. So my friend, after writing AMC1, some of you might know him, he got a job. So he's currently in Australia. However, his wife passed the AMC1. Though I think she would have gotten a job if she was applying broadly, but she, because she wants to stay with her husband and the hospital is working, there were no slots to sponsor her. So unfortunately, with her AMC1, she can't get a job there. But then she's preparing for AMC2. So after AMC2, you can then start, you can get a job, and then start, after a job you can, I think, get into residency. But I think that's the pathway. So I'm not, there's a group for the Australia route. Anybody that wants the Australia route, I can always talk to her or like put you in contact with her or him about the Australia route. But that's also a very good route. They pay okayish. I think, but I had it's either similar to the UK or slightly better than the UK. And I don't know about work-life balance, to be honest. I've not asked about work-life balance. But yeah, that's the pathway for Australia. So, but you have to write your English exam. I think it's similar cutoff like IELTS for PLAB. So seven, at least 7.5, and at least 7 in all specialties, and then AMC1, AMC2. But you know you have to write AMC1 in South Africa or Philippines. Are there states for easier matching to competitive program? Unfortunately, I don't think there are states that are easier to match. No, to be honest. Like, there are lots of things. So the truth about the US matching is that there are lots of things lots of factors that plays a role in matching into the US. Like, if you have connections, that helps you. And there are just lots of things that plays a role. So I wouldn't say there are states easier to match. No, competitive specialties, any state is difficult to match, because even the US graduates are also fighting to get into that spot. So I don't think there are any states easier to match. Even if for internal medicine, I don't see any states. If there are some states that are more AMG heavies, which are American Medical Graduate heavies, and some are, you have like New York, New Jersey, you have lots of IMGs for internal medicine. But then it still doesn't mean that, okay, this state is easier to match into or apply to this state. It doesn't work like that. How about Canada? Is it also cumbersome like the US? Canada, I would say Canada is more difficult to match into than the US. Why? Because the US has more programs, lots more programs than Canada. And so Canada has lesser program for you to apply to. So you only have few slots for international medical graduates. Most of their slots are left for their own medical graduates. So it's very difficult to match into Canada. And yes, Canada, it's almost similar to the US. I know USMLE has step 1, step 2, step 3. Canada, they have COMLEX 1, COMLEX 2, COMLEX 3, which is almost similar. That's why you can easily practice. After finishing in Canada, you can easily practice in the US. And after finishing in the US, you can easily practice in Canada. So it's kind of similar. And yes, I would say it's cumbersome. I would say it's more difficult to match in Canada than the US, because they have lesser spots in Canada than in US. So it's easier to match in US than in Canada. Okay. I think those are the
Thank you
questions.
very much, sir. Thank you very much, sir.
I'm
My
sorry.
God, this is
I think I was rapping. I'm so sorry that.
no, 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 no. You weren't. You weren't. This is so much. This is so much great value to us, Kai. Can we say thank you very much, sir? Can you put up your emoji of love, Kai? This is so awesome, 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 awesome,
Thank
awesome.
you very much.
Thank you very, very much. What more can
You.
we give? And come on, this is so much. Thank you, sir, for the value this night. Can somebody say value? This is so much loaded.
So that's my number again, in case it's mixed up on the chat. You can easily send me, and please just
Please, you can. Please, the
introduce
numbers
yourself,
are
and
there. Please try as much.
just introduce yourself and just say I'm from this place, and I'll respond.
Yeah, guys, thank you very much, sir. I don't know what you thought that we cannot reach out to you from this point and say, okay, sir, this is a wine for as a king, as a celebration. Thank you very much. So you can see that we have so much persons that of this kind of caliber, of this kind of prestigious caliber, let me put it that way, to talk to us, to make us understand the pathway, not just to one country, US and UK. So thank you very, very much. So I would love to also ask that you help us also for the Australian pathway with someone who will also talk to us, also Canada also. I think I'll reach out to you on that aspect also.
I don't have. So the person I have in Canada is kind of like, it's not really my close friend. So I don't know how possible I need an orthopedic surgery. So I don't know how possible for him to come give a talk. But with Australia, for sure, I can reach out to my colleague. He also was one of my classmates back in NDU, so he should be able. I'll reach out to him or her or his wife. One should be able to. Well, Canada, I don't think that, because I only know that guy. I don't know any other person in Canada.
Right. Thank you very, very much. Can we say thank you much, very sir? Thank you very much for that opportunity again. Thank you very much, sir. Thank,
Thank you,
thank you for
guys.
the
It was nice.
time,
Thank you
the
very
time
much.
you
God bless you.
time, the time you took to explain and explain, to also present adequately, giving us the whole breakdown. So thank you very much for your time. God bless you so much. Thank you very much, sir, for the time. Thank you very much. I don't know how to stop saying thank you for the opportunity you took, despite the time difference and also time you took to expatiate, to elucidate completely concerning the whole aspect, and also you shows that you have a heart toward us to ensure that we get it right at this time. One of the cardinal points I took was to start early concerning our our plans in studying outside or going to practice outside. So thank you very, very much, sir. So we have an ex officio here, a person of Sir Abraham Rico. I want you to say one or two things to our speaker before we close.
Okay, good evening, sir.
Good evening.
Sir, thank you very much for this session you've had with us. So many of us have been looking for the information you just handed to us for free, and we are very, very, very grateful. You just your wealth of experience in both the UK and the US is very, very valuable. I'm very, 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 very sure that so many of us will be in your DM to ask for more. Thank you once again. Thank you very much.
Thank you. I'm honored to be here. It was nice meeting you guys.
Thank you very much. So, guys, thank you very much. This is so awesome. Get ready for tomorrow, and also we'll still have some spare meetings in this line Japa series. We'll have persons who talk to us in different aspects of countries to make us understand the pathway and also the role of divine direction toward taking this step. So, thank you very much. Can we just pray a little bit and say, Father, thank you for our speaker, that God should bless him, give him more open doors, that God will come to take him higher and higher in every ramification of his life. Can we just say a word of prayer and say, Father, thank you for his life. Thank you for using him to elucidate and to explain certain things regarding US and UK to us. Father, we thank you. We thank you for our uncle, our mentor. We thank you for using him this evening to talk to us. We thank you for using him to elucidate greatly. Father, we bless you. Father, we thank you. We give your glory, we give your thanksgiving. And we ask, oh God, that you bless him in every aspect of his family. We ask that you show him your love, your mercy, and you give him God's divine direction with everything he needs, oh God, in the name of Jesus. Father, we ask, oh God, for as many of us will be taking this step, we ask that your hands will be upon us and will guide us appropriately, oh God, in the name of Jesus. In Jesus' precious name we pray. Amen. CMD loves you. I want you to also remind others about tomorrow's meeting. We love you from our hearts. I want to also say from those from BMU,
Thank
you're
you.
welcome. Those from other schools, you're welcome. Thank you very much. We'll see you tomorrow, same time by 7 p.m. tomorrow. Have a wonderful night's rest.
Amen.
We love you.
I love you, Papa. Thank you. Thank you so much, Dr. Taboy.